Hello, if you are experiencing back pain and you've had back pain for a very long time, or you've recently just injured yourself, you come to the right place. I'm Dr. Lin with Empowerment Physical Therapy. And I've been a physical therapist since 2014, so it's been about 7 years and I've seen numerous patients complaining of back pain. And what I'm going to go over today is the number one cause that might be causing your back pain. The one thing that most people tend to overlook, and it's the first thing that I look at when someone that's complaining of back pain comes to my clinic, whether they've had it for the past 5 to 8 years, or they've had it recently. So the number one thing is that seems to cause back pain is an uneven pelvic, what we call also known as lateral pelvic shift. When your pelvis is not even, that is the number one cause that I see in all the patients that have came in complaining of back pain. So there's two forms of what we call an uneven pelvis. How does it occur? Where does it come from? How do I know if I have it? So there's two ways, to kind of break it down into two ways. There's the functional and the structural cause of an uneven pelvis. Well, let's start with the structural. So structural is more innate, and because of your structure, the first thing that could cause an uneven pelvis is when you have a leg length discrepancy. What that means is your one leg is longer than the other, and that's a much harder change to do. So depending on how much of a leg length discrepancy you have between the left and right, the first thing to start with is probably a heel lift to kind of even it up. The second structural cause of an uneven pelvis is scoliosis, and that is defined as a curve in your back, or an S curve or a C curve, and that will create an uneven pelvis. That's going to throw your back off and create an imbalance, and that will innately cause your back pain. That in your back is the foundation of where all the movement comes from. So if your back is uneven and tilted, guess what happens? Every other movement that starts from there is going to suffer, and your body above the chain and below the chain is going to create a sort of what we call a compensatory behavior. You're going to start to compensate for things, and your body is very good at that. And then we're going to talk about sort of the next thing we're going to talk about is the functional aspect of an uneven pelvis. That's often a result of a lifestyle thing or a sort of an injury that you're dealing with. The first thing, in an example of a functional uneven pelvis, which is often more correctable and easier to change and correct, is if you have been limping around for quite some time, whether you're in boots, or if you had an ankle injury, a knee, or a hip issue. Anytime you're limping on one leg for quite some time, that is going to cause you to use the opposite leg to engage a lot more. And as a result, and over time, you're going to create an imbalance between the left and the right leg, which is going to cause an uneven pelvis to occur, which as a result would cause back pain. The second thing that I happen to see much more frequently and often with our older generations, and it's just more of a lifestyle habit that they have, is they put their wallet they often put their wallet in the back of the pocket. That's not a problem. The problem is when they sit down with that wallet in the back of their pocket for quite some time, and they do it consistently over the course of 3 months or 6 months, that's when it creates an uneven pelvis. That in return is going to create and cause their back pain. And the way to identify an uneven pelvis, which is probably one of the easiest ways to identify an uneven pelvis, is to look yourself in the mirror. And we'll kind of go over this. I'll show you how I typically would like to see. So the way to kind of self-identify is to put both your hands right on the top of your hip. If you notice that one hand is higher than the other, then you probably have an uneven pelvis, given that you're standing about shoulder width apart. Or if you notice, and I'm going to exaggerate, if you notice that your hip, your lower body, is going more toward one side and your upper body is going toward the other, or sort of there's a dip in your shoulder, that's often an indication that you might have an uneven pelvis. And with that in mind, that's sort of, so a couple things, 2 things to know. Your uneven pelvis could be a result of either a functional issue or a structural issue. Functional things is something you can resolve pretty easily. It's one thing is limping on one leg and then sitting with your wallet in the back of your pocket. Structurally, you can have the 2 causes of uneven pelvis is scoliosis, that's the first thing, or if one of your legs is taller than the other. So that wraps up our session for today. If you want to be empowered with a mindset, toolset, skill sets to lead an active lifestyle, to recover from an injury, and to stay mobile and independent for many years to come without relying on painkillers, injections, and surgeries, then subscribe and join us. And if you're looking for safe, non-invasive, drug-free solutions that looks at the root cause of your problem, then I urge you to schedule a complimentary discovery call with me so you can get some advice on what to do next so that you can make the best decision about your health. Otherwise, stay empowered.